Hi there, and welcome to another episode of One Clear Vision. I'm Dr. Sophia Capo, the pediatric and vision rehab optometrist, and today I'm joined by a friend and colleague, Gerome. Hey, Gerome.
Thanks for having me.
Gerome is a physiotherapist and the rehabilitation director at the Concussion Care Clinics here in Kelowna. And today we're going to be talking about interprofessional care with concussion and how important it is to have this multidisciplinary approach. So thank you for coming on with us. So we're going to start off just by, why don't you just give us like what is a concussion kind of answer from a rehab perspective? So you're a physiotherapist, but you have a lot of training in concussion. So tell us, what is a concussion?
Yeah, so I think there's a lot of misconceptions about what a concussion is, but at the heart of it, a concussion is a traumatic brain injury. So what that means is there is a direct blow to your head, your neck, or somewhere on your body that causes that force to get transferred up to your head. And so when that happens, you're going to see some brain injury as a result, and then from there you're going to have a chain reaction that causes things like a change in blood flow, you're going to see increased symptoms, and then you're also going to see some inflammation as well. These symptoms can come up either immediately, but they can also still show up after a little bit of time. It could be a couple hours or maybe even the day later as well.
So it doesn't have to be like immediately after the blow to the head. The symptoms can come on later. Okay, tell us about those symptoms then. Like, what are the most common concussion symptoms that you see?
Yeah, so these symptoms we usually see, the most common one is going to be a headache, and everyone kind of knows that one. But I would say some of the other two most common ones would be some dizziness and then also some visual complaints. And that's why we typically work with individuals like yourself, Sophia.
So what kind of vision things do you see usually? Like, what specific vision things are they complaining about?
So the most common one would be if someone complains about light sensitivity. So oftentimes you'll hear people say, I have to be in a dark room, or I have to pull down all of the blinds or the curtains. As they try to get back to school or work, they'll also complain about difficulty with their vision. Specifically, things are blurry. They can't read off of screens, they can't read off of their phone, and then that becomes pretty tricky, and after time, they start to have some more symptoms like headache.
Gotcha. So then tell us about like the CCK clinics in general. So that's CCK was Concussion Care Kelowna. Now it's even bigger than that. Can you explain to us like what the clinics are, like how you run the rehab program?
Yeah, so our clinic is a multidisciplinary clinic that was created to try and address a gap in concussion care and management in Kelowna. So the clinic has a variety of different streams. There's a physiotherapy stream, a kinesiology stream, there's a counseling stream for mental health. We work closely with optometrists, occupational therapy, and sleep. And then the program is kind of consulted by a neurologist and some general practitioners. So we do have a variety of different experts in the room, and hopefully together we can kind of work together to cover the whole scope and the whole kind of picture of what a concussion how it can impact someone's life.
So is Concussion Care like the only clinic that has, that overseeing kind of neurology, medicine kind of integration into the clinic? Because I know there's a lot of like rehab programs, but is this one kind of like the biggest or the one that has like the most medical involvement?
I would say there's a variety of different practitioners out in our community that are fantastic concussion providers, but ours is unique in that we have so many people in one house, and this helps to reduce some of the burden of patients having to schedule their appointments with a variety of different practitioners at a bunch of different clinics and a bunch of different locations, which can be really hard for normal able-bodied people and a little bit more intimidating for someone who's suffering from a brain injury.
Yeah, definitely.
So what we'll try and do is we'll try and help people schedule those in a really collaborative manner and also try to prioritize things. Post-concussion, it's pretty tricky to try and do everything to kind of help yourself recover. So we'll try and break it down into more kind of manageable sections and focus on the things that matter the most first.
So then what happens, like a patient has a concussion, they come into the clinic, what does an assessment look like?
Yeah. So an assessment will first be triaged by our physiotherapists. We have a lot of information, a lot of experience across a wide scope of different kind of things. From there, we're going to try and understand where the root problem of that particular concussion kind of lies. Is it related to how those eyes are moving? Is it related to what's going on in your inner ear with your balance? It could be memory related. Or during that conversation, there might be a lot of topics brought up around anxiety or maybe a little bit of PTSD. Based on what kind of comes up in that initial triage assessment, we're better able to kind of come up with a plan and say, who is the best person to help work with you in your particular injury?
Gotcha. So it's kind of like custom to every person who comes in. So no one who comes in is going to have the exact same team or the exact same management plan.
Totally. So everyone's situation is a little bit different. Even with this exact same injury, your history, your job, your interests, your overall health, all those things will definitely factor into your specific, unique, customized plan there. And so based on that, our goal is to try and make that as streamlined and as efficient as possible while also being effective.
Cool. When should someone seek help for a concussion? So like when do you start seeing people for their concussion rehab? Like what's the earliest someone can go to you?
Yeah, we see people who are in all different kind of facets of their concussion recovery. But in an ideal world, I would say I'd love to see someone within about 5 to 7 days after their first kind of injury.
That's pretty quick.
Yeah, it is pretty quick. But the idea there is that if we can be proactive, then ideally we can catch these things before they kind of increase in severity or increase in their kind of impairment for individuals as they kind of work to return from that injury. The great news is that there are a lot of concussions that do recover on their own. So there are individuals that I'll see first, we'll assess it, we'll come up with a plan, and that's the only time that I'll see them because they're able to kind of seamlessly progress back into their normal activity. And a significant number do get better within about 2 to 4 weeks typically.
Okay. So the majority, you would say, of the people, if they come proactively, like they're getting some sort of a plan, and the majority of them do get better within a month or so.
Totally.
Okay, and then what happens to those people who aren't better in a month?
Yeah, so the ones that aren't better, there's typically something that's kind of not fully been investigated or fully worked on. And so these symptoms can then kind of cause a downstream cascade of symptoms and impairments. So I would say one of the more common ones that we'll get is that patients will report they have a concussion, they've been struggling for it over maybe a month or more. And so when we take that look into what's causing some of these symptoms, we'll find things like, hey, this person has returned to their full work, but they're still struggling with focusing on a screen or on a phone. And so trying to do that over a full workday becomes really, really strenuous. And so by the end of that day, they're going to be quite symptomatic. So if we can try and figure out what's causing these symptoms, then we can kind of get to the root of the problem and try and figure out a way to resolve that versus kind of putting a very expensive Band-Aid on top of it.
Gotcha.
Yeah.
So if someone, let's say, because sometimes in vision rehab, like I see people who have had a concussion 2 years prior and who are still struggling. So if someone out there is, many months out of their concussion and still feeling like the symptoms are lingering, are those still people who can come to the clinic and get treated? Like, is there still a plan for those people too?
Yeah, absolutely. So the beauty with concussions is that the big word in that recovery is neuroplasticity. So with neuroplasticity, what we're trying to do is we're trying to challenge the brain and get it to learn how to do things in an improved manner. And as we continue to learn and adapt and grow, then we're really trying to see if that brain can kind of keep up with our everyday activities. So regardless of where you are with your kind of concussion recovery and journey, I always do think that it's worthwhile to kind of check in with a concussion therapist to identify if there's any particular kind of barriers to your recovery and whether or not there is something that can be done to try and address that particular problem.
Cool. I just want to know, what are some common misconceptions about concussion recovery?
Yeah. I think concussion is really tricky because it's something that everyone has kind of heard of, but there's also a lot of kind of rumors or myths out there that can make them a little bit scarier than they actually are. So I think the number one thing with a concussion is that most people think that you need to be an athlete and you have to get hit directly in the head to have a concussion. But really anything that will cause your head to suddenly shake or jolt back or move is enough force to cause the brain to kind of bounce around within the skull. So if you have something that causes that particular type of injury and you're having these symptoms, then that is defined as a concussion injury.
So does it have to be, because sometimes I think people might say, well, I didn't even hit my head that hard, like it's probably just a little headache. Or you go to, maybe something doesn't come up on imaging, there's nothing seen on an MRI or on a CT scan. Like, how do you know then if it really is a concussion? Or do we just base a concussion based off of the symptoms that we know that they have?
Totally. I would say, unfortunately, there is no imaging that will actually pick up what's happening with the brain in a concussion. And that's why it's called a mild traumatic brain injury. So we do diagnose concussions based on a presentation of symptoms. So there's a lot of different injuries that give you a headache, but if you take the injury with the concussion with a headache, but you also have some memory changes, some vision issues, and some balance problems, all of a sudden that list of injuries that can cause all those symptoms gets smaller and smaller and smaller. And it's our job as medical professionals to rule out anything else that's going on. And if it doesn't, then we can attribute a lot of those symptoms to a concussion.
Gotcha. How important is, following the evidence-based best practice for you in the concussion world? Because I know I've talked a ton about how important it is to stay up to date on the research and to make sure that from a vision standpoint, we're doing things that are straight and narrow, and also, bringing in people when we're not 100% sure. How do you feel about evidence, and how do you use evidence in your concussion practice?
Yeah, I think that's a really great point, Sophia. One of my passions in healthcare is ethical practice. So I do get really frustrated, or I do feel really bad for patients when they seek these poorly supported treatments that cost them a lot of money that don't end up actually helping that particular patient. So within our clinic, we strive to really stay on top of the evidence and only make recommendations that have a lot of support in place to ensure that we're offering these individuals the best information and the best recommendations that we can. Concussion care is tricky because it's not covered by public health or MSP.
Same thing with vision.
Totally.
It's hard.
So it's hard for me to justify asking someone to spend a lot of money to come and speak with me and to work with me if I can't justify that care is the best and most ethical and the best kind of most cost-effective care as well.
That we can have for them. Mm-hmm. Yeah, 100%. I agree with you. Now, we talked about some of the vision-specific symptoms that people have in concussion, and I've talked about these before too, how we can get the double vision and the light sensitivity and difficulty with the focusing ability. So it might, you might still have 20/20 vision, it might be clear, but it's sometimes blurry or sometimes double, or it's not consistent good vision. How do you, approach assessing vision in your initial assessment?
Yeah, so we're not a specialist in vision. That's where we kind of refer people to you, Sophia. So what we'll do is we'll do a screen where we're looking at how those eyes are moving, how people are able to focus, and we're looking for some symptoms. So it's like, hey, does this make your headache worse? Can you keep this in focus? When does it get blurry? And there are some cases where it's pretty minor, in which case we'll say, hey, you know what? Let's see if this concussion and this vision problem can resolve on its own or with some simple exercises. But once it's kind of past 2 or 3 weeks and we're not seeing much improvement or change, then we're looking to make that referral over to you because we want to be very proactive with that care. And the sooner we can kind of tackle these problems, the sooner we can hopefully get people back to their normal activities.
Yeah, I think it's a really great plan to kind of keep the patient for that first acute 2 to 3 weeks, because the visual system sometimes, after a concussion, you got the headache, you got the dizziness, you have some double vision, but that goes away. And you don't need to go to, a specialized assessment to get everything checked if, after that few weeks, everything is fine. And from that point, they can just go to their general optometrist for their routine care. Where I provide a lot of value is, after that time, if things aren't getting better. Like you said, there's a ton of really excellent physiotherapists and providers who know how to do some little vision exercises in those first few weeks that sometimes just get people to where they need to go. But it's after that we're like, okay, this is not clearing up, it's been too long, and let's try and catch it after that 3 weeks or month instead of leaving it for years and years. Because I would say, since we started working together, I'm seeing people, in that first month or 2 months, which is the perfect time to get their vision symptoms under control. But I often see people coming after a year, after 2 years, which is way too long for them to be struggling, especially if some of them are like back at work or half time at work, and they're just trying to push through their symptoms rather than addressing them. And sometimes it's a really simple fix from a vision rehab standpoint, but we're just not, people don't know where to go and they don't know how to find us in that spot. So I'm very grateful that you know how to identify the vision, that you send them over in a reasonable amount of time. How do you educate your patients then on their recovery and their symptoms? Like, how do you know how it's going to go? What's their prognosis?
Yeah, I would say a lot of times, these symptoms are pretty scary and a lot of people haven't experienced them before. So step one is just to validate and say, hey, you know what, I hear you. These symptoms are commonly seen, and what we see here is a concussion injury, and that can really help alleviate a lot of that kind of anxiety and fear around the injury itself. And once we have a better understanding, then suddenly it doesn't seem quite as scary anymore. So we do spend a big part of our kind of initial appointment just kind of talking about what is a concussion, what are we expecting, and how is that going to impact your overall kind of life there, and what we can do in the short term. The second piece there is just understanding that because a concussion is seen as a mild traumatic brain injury, then we want to actually start getting people back to some safe, normal activities as soon as possible. So previously it would be like, hey, you know what, hang out in a dark room for as long as you need to until those symptoms go away. But with the new evidence that we have, we actually want people to get back out in the community in a small, safe, sustainable manner, and from there, slowly increase it as they can handle more and more. And the sooner we can do that, the better the outcomes.
So it's almost like the brain can heal faster, and that neuroplasticity you were talking about works if we expose ourselves to things that we were doing before, but in a safe and kind of structured way.
Totally. So we want to keep those expectations in check. We want to understand what is a safe level of discomfort or pain, and then that beautiful word of neuroplasticity. If we can get you starting back in that a little bit, then your brain and your body's going to slowly adapt, and it's going to see those things as normal, safe types of activity versus something scary or dangerous and gets you kind of all symptomatic all over again.
Gotcha. One of the unique components of the CCK clinics that I really enjoy is the fact that you integrate a sleep specialist. Can you just talk a little bit about sleep and how important sleep is in concussion?
Totally. So sleep is like a branch of medicine that stands alone on itself. However, it does kind of touch and impact every kind of component and facet of our life. So after a concussion injury, there's a energy mismatch. It takes a lot of energy to do pretty normal things. So we get tired super easy. And then as we get tired, we get all these symptoms. So we look at sleep and say, hey, when you are sleeping, especially when you're sleeping well, that is that opportunity for your body to recover, to consolidate learning. And therefore, from there, we want to try and build upon every single day and build upon every single experience that we have, so that neuroplasticity really starts to take hold and continue to build up and up. So within our clinic, again, as a physio, we have some experience with sleep, but we're by no means that specialist there. So we'll offer some basic advice there and try and come up with some solutions to improve that sleep initially. And then if it doesn't work out, then we'll start referring individuals to our sleep therapist to really look much closer and try and better understand what's going on. And especially if you're someone like a nurse or an RCMP officer where you have some shift work that impacts your sleep, we want to find ways to improve that sleep without completely wrecking your schedule.
Gotcha. And I think it's really great, like you said, how everything is kind of compartmentalized. Like you have people in your clinic who know a little bit about everything, but then know exactly where the breaking point is and where the point is that we need to involve someone else who knows a lot about one specific thing. And that's what I think is really cool about neurology branch and the sleep branch and the kin branch, because kin helps people get back to their activity, which is something that's so important in our concussion recovery. Can you talk about what's like some success stories? Like, what are some things patients say after they've been at your clinic and have received some of this interdisciplinary care?
Mm-hmm. I think the number one takeaway from patients is that they feel heard and that they feel listened to. I think concussions can be tricky, especially if you work with someone who's not experienced with them, and that in some situations, those individuals don't have a lot of tools to try and help patients who are suffering from those symptoms. So when they come to our clinic, they say, hey, you know what, I'm so glad that I'm talking to someone who has experience, or who understands the symptoms that I'm having, and has come up with a plan that's going to work with me to try and get back to some of those activities again. And that, depending on those symptoms, it could be working with the optometrist or the physio or the kinesiologist. And really what we're just looking for is we're trying to measure where you're at first, and then progressing in a way that eventually gets to a point where there's a tangible or a meaningful change or improvement in their overall kind of function. In healthcare, I think the most satisfying thing in the world is to work with patients and get them back to those kind of like meaningful or important things, whether it's being able to go back to work, or playing music again, or being able to spend time with their grandkids. And so as we get to work with those individuals and we get to celebrate those victories, it's a really, really great feeling.
Yeah, definitely. So then what advice do you have for someone who feels like they're hopeless and lost, and they've tried going to physio before, they've seen their practitioners who have said everything looks fine, you just need more time, or I don't know, this is the best it's going to get. Like, what advice do you have for those people? Because we hear that all the time.
Yeah, so unfortunately there are some injuries that do have a lifetime kind of impact on individuals. And oftentimes we're just trying to reframe that perspective and say, hey, let's focus on what's important, or what are you able to do versus what are you unable to return to. In the world of concussion treatment, it is a constantly evolving kind of field of care. And sometimes it's worthwhile to check in with those individuals and say, hey, has anything changed in the last 6 months or in the last year? And we can say, hey, you know what, there's this great new treatment, and it's only been around for the last month or two, but it has some really promising results. I'd love to try that with you. But at the same time, we're trying to balance that ethical piece by saying, hey, you know what, maybe there hasn't been any change, or maybe it doesn't quite apply to you, and it's hard for me to recommend you spending all of this treatment on like a prospective idea, on a lottery ticket or anything like that. So we're trying to balance those different pieces for sure. End of the day though, Sophia, it does go back to that neuroplasticity, where the nice thing is that if we look at the brain, the pieces are all there. We're just trying to find really new, innovative ways to kind of get that brain to work better, or get various different kind of nerves to kind of reconnect in a way that helps us kind of complete those really complex kind of activities and get back to those normal activities.
Exactly. And we see this in vision. I think I've used the analogy before. It's like, just because you have two healthy feet, that there's nothing wrong with your feet doesn't mean you can dance, because dancing is very coordinated. And it's the same thing with a lot of the physio. It's, the brain is there, and maybe there has been something that shook it up, but the pieces are there and we can coordinate them back together, but it's just the process of going through it and trying to find strategies that help, in my world, the brain and the eyes connect, or in your world, all of the muscles and their autonomic nervous system and all the other pieces that we have to put together. Do you have anything else that you wanted to share before we go? Anything we missed?
I just think if you do have a concussion, I think the biggest takeaway for you is, please do try and return to some of those activities really slowly and carefully, and try not to avoid anything outright. If you give it a try and it becomes too much, then you can take that step back. And the best thing there is that you tried and that you're still safe. It really kind of breaks my heart when I get people who have had a concussion and they've really kind of become quite isolated at home and they can't return to those activities, because the sooner we try and work on returning, oftentimes the better the outcomes there.
Awesome. Thank you so much. It was great to chat with you. Again, Gerome from Concussion Care Clinics from CCK, and thank you so much. We will chat another time. Thank you.
Always a pleasure, Sophia.